Hi friends and subscribers, this is a case of a ruptured ectopic pregnancy with laparoscopic removal of the fallopian tube. Now, what is an ectopic pregnancy? Ectopic pregnancy is a type of an abnormal pregnancy that has taken place in this particular patient. So, an abnormal pregnancy can one thing be that the pregnancy is genetically or health wise abnormal, or the second thing is that the pregnancy can be in a wrong location. So this is a type of, in this particular case the pregnancy is in a wrong location. So this pregnancy took place in the fallopian tube of the patient, which we could diagnose by ultrasound and beta hcg blood test. So over here we have just entered inside the abdomen and we have found that there is a lot of blood collection, which is called hemoperitoneum in the medical language. So here we are on your screen, we are inserting a side port. This is one side port that we have inserted, and here we are inserting the second side port. Side ports are those smaller diameter ports through which the operating instrument enters. So in this particular case we have one camera port and two side ports, and now you are seeing on your screen this is a suction aspirator. So this is a device connected to a suction machine and it helps in sucking the clots. Now when you enter the pelvis, as in enter the abdomen of the patient, the first thing is to visualize the problem that we have. Here you can see everywhere there is blood and we cannot see which is the place the blood is coming from. So first thing is to suck some of the blood out sufficiently to make sure that we can see where the problem is. So here there are some adhesions which are there. These are newly formed adhesions, that's why they can be very easily removed, and this proves that this ectopic pregnancy is fairly 1 or 2 days old. So now you have the uterus which is coming into view, and using the suction aspirator we are getting some of the blood out. We know directly that we have to go to the right side of the uterus, reason being we have done an ultrasound on this patient. So now all that we need to do is, we know that the pregnancy is in the fallopian tube, that is due to the ultrasound that we have done, and all that we need to do is we just have to expose the fallopian tube and assess whether we can save the fallopian tube or not. So usually when the patient presents and it is a case where there is no bleeding inside and the patient has presented early to the doctor, that is when we say it is a unruptured tubal ectopic pregnancy. In these sort of cases we can save the tube, and we need not cut off the tube, and we can just get rid of the pregnancy which is in the tube. You can check out our video on this, it is there in our channel. Whereas in this particular case you can see many things are adherent, as in stuck to each other. This is because of this patient is presented a little late. She must have not understood that whatever pain and whatever symptoms she got is a life-threatening emergency. So here we are holding the fallopian tube and pulling it out. You can see that a spurt of blood came from that particular area. That is the area which had ruptured, and you can see the blood clot which is there. That is the area of the fallopian tube which had burst open. So over here we see that this area is not salvageable, as in we cannot repair this tube, and the only way to safeguard the patient's life is to get rid of this bleeding part. You can see as we are holding, she is still bleeding. So we are just having a look at this area completely, and most probably we are planning to excise this fallopian tube. So let us think about the anatomy as well. The fallopian tube is linked to the uterus and the ovarian ligament with a structure called the mesosalpinx. Mesosalpinx is that part which supplies the blood supply to this fallopian tube. So when you are planning to remove the fallopian tube, you have to make sure you cut off the blood supply from the mesosalpinx as well. So here we are just clearing this area, In case the patient is not hemodynamically stable, by now we can already cut the blood supply and ensure some hemostasis. So over here now you can see we have changed to another instrument. This is called a bipolar shearer. This uses bipolar current to make sure there is a little bit of burning of the tissues. Here it coagulates the tissues and makes sure that the blood vessels inside are stopped. So there you can see, first we give coagulating current, that is the blood stopping current, followed by a burst of cutting current in the middle. So as we keep on going ahead, the part that we are cutting is called the mesosalpinx. So mesosalpinx, as I told you, contains the blood supply of the fallopian tube. You have to little bit tug on the fallopian tube to make sure the mesosalpinx exposes itself very well. And what we are coagulating and making into a white color coagulum, it is the blood supply. And here we are using cutting current to cut it. Already you can see that the bleeding from the fallopian tube has already stopped. So the life-saving part has already been achieved. So now you can take your time and aram se make sure that you are doing a very good job. You have to these patients usually are in their reproductive age group and they are usually wanting to have a future pregnancy. So make sure that that cut that you are giving on the mesosalpinx is closer to the fallopian tube than the ovary. This preserves the blood supply of the ovary and make sure that the ovary functions very well. So this is the final part linking the fallopian tube to the uterus. So there we are using a different type of a bipolar instrument which gives a slightly better and a deeper coagulation effect. We give a short burst of coagulation, making sure that this part can be easily chopped off. So ectopic pregnancy is surgery is one of the easy laparoscopic surgeries that you can do early during your laparoscopic career. However, one thing which is important is you should be able to put in your ports quickly and reach this part very quickly, because sometimes your patient may require a very quick surgery which you should be able to deliver. From the screen timer you can make out that actually the life-saving step takes around 3 to 5 minutes from the entry. Laparoscopic surgery as far as ectopic pregnancy is concerned is very quick and much better, I feel, from the time perspective as compared to an open surgery. Also you can make out that there is absolutely no blood loss due to the surgery per se. So this part that you can see, that is the mesosalpinx. I hope you have learnt a new name, and that is where the blood supply to the fallopian tube comes from. Sometimes it is necessary to note that the patient may be having a low blood pressure, and you have to ideally increase the blood pressure before checking the hemostasis of the mesosalpinx before proceeding. In this particular case, what we end up doing is we are sucking the pouch of Douglas, because this fallopian tube that we have just now excised, I will be removing it from the vaginal opening. I have not documented that part because it has been covered a lot many times in my previous videos. Do go and check out in case you want to know how I remove the specimen vaginally. So here just a lot of suction is going on. It is very important to get rid of these clots which are there. One thing is by removing all these clots and blood, it reduces the post-operative pain and reduces the chances of any adhesion formation. Also it is also a good infectious medium, so removing all the clots will make sure there is not much infection that happens. So now you can see most of the clots are suctioned out, and the blood is also becoming lighter and lighter. Here, while examining the rest of the pelvis and rest of the organs, we have come across a very tiny cyst on the left fallopian tube. So this is a fimbrial cyst, that is a small ball of water inside. It's a cyst like a water balloon inside the fallopian tube's fimbrial end. So fimbria are very important for the functioning of the tube. So what we are planning to do is we are just planning to remove only this water balloon without damaging the fallopian tube's fimbrial end. So here we are using very tiny sharp scissors. The tip of the scissors is just a few millimeters across, and our agenda is just to make sure that only the water balloon is removed and the fallopian tube is not at all damaged. It is a very fun to do surgery. All the cyst removal surgeries are very fun to do as a surgeon. However, one has to have very precise hands while doing this, because in case there is some bleeding that happens, again we have to use coagulation, which again may burn and destroy the fimbrial ends. The fimbrial ends are responsible for grabbing onto the egg when the egg is released and helping or facilitating the entry of the egg into the fallopian tube. Here you can see almost the entire cyst has been removed out. Only thing, we have to detach it and be done with that. So now I have changed to graspers on both the sides. And there we are removing the cyst out from the fallopian tube's end. Yeah, so here you can see almost the entire cyst is out. It is only held by a small base which is a little fair bit adherent and may contain some tiny blood supply. You can also make out that we have not injured the fimbrial end of the fallopian tube. It's a very gentle and slow surgery that we are supposed to do. There on the left hand side you can see the left grasper is protecting the rest of the fallopian tube, and though we are trying our best to pull it out, it is not going out, mainly because that's where some few blood vessels may be there. So this is our same old device, which is the energy device. This is called the bipolar shearer. All that we are planning to do is give a very short burst of cutting current over here, which will coagulate the vessels and will separate it out. So there you can see it's a beautiful instrument that does its job very well, and without a drop of blood spilled, we are protecting the fallopian tube and getting rid of this tiny ball of water. So both these things can be removed vaginally. Thank you.